Hello everyone, it's Rafael Gutierrez. Welcome to our channel. And today I'm going to talk about something that's been really hard for me to say because in part it feels like I'm offending people. I may offend people when I say this. In part it feels like I may end up shooting myself in the foot by saying some of this stuff. And so I've been trying to work out how to say it. Now the first thing I want to tell you is I do have a gift for you guys. And that it is in this channel. What it is I actually developed a basic class to start learning human anatomy. And it's actually, if you go to this channel's list, topic list, you'll actually see that something called self-study anatomy. I actually made that so people could teach themselves anatomy, whether they're going to take a class later, they're just interested in getting the basics of anatomy. And to give you guys more information, I actually do have the anatomy book, which right now I call it the Human Anatomy, a Clinical Approach. It probably will have a different name coming out soon because it's the one that's going to be coming out in a couple months will actually have about 100 more pages, more pictures, more pages, more information, and it is meant to go with the lectures that I made here on YouTube for you guys. Part of the reasons I did that is, like I said, I've actually seen people take anatomy and have to retake it, not because they didn't try but because they had to self-teach themselves anatomy. What I mean is this: a lot of times in college, actually anywhere from community college to even doctoral programs, you'll have places that don't hire people who are adequately trained in anatomy. I met a person who taught at a doctoral program who had a master's in avian biology, and they were teaching doctoral candidates anatomy. I found out later some of the doctoral candidates had master's degrees and had worked in clinics. So when this person was teaching clinical anatomy to them, the students were more qualified to teach a class than the professor. Community college, I've had a student one year who had a professor whose doctorate was in chemistry, had never taken any biology class, but he needed a class, so he took the anatomy class. And she said she had to drop it because it was completely unpassable. He had a person reading the book, and any questions, he said, "Oh, I don't know. You read it in your book like I am," and that was his response. I've actually worked with people who are lead instructors for anatomy and have masters in oceanography. So one of the things that I notice is a lot of people who are teaching anatomy aren't qualified to teach their classes, but it is what it is. So I did want to give you guys a gift of being able to take an anatomy class online free. If you guys have any questions, you guys can put it on the comments, and I do. Anytime I get a comment, I will answer it if I can at all, as soon as I can. It's a free class, so give me a break. The other thing I did want to talk about goes into this and what the difference between science opinions and why there is a huge value for anatomy, especially clinical anatomy. Now, I'm going to start with science and work my way backwards, and then talk about opinions, and then talk about the value of clinical anatomy. Science is not what most people think. Science technically means knowledge. Now, you can divide science into a lot of different divisions. The main divisions, you actually can end up having the one that we call science, what we usually refer to when we're talking about science, which is natural science. Now, natural science, we use what's called the scientific method, where they make this huge complicated thing, but the truth of the scientific method is you make an observation, you make an intelligent guess based on your observation, which is called the hypothesis. You test your hypothesis, and based on your test, you're actually usually trying to disprove your hypothesis. You either accept your hypothesis, which at that point becomes a theory, or you reject it, and you have to accept another one. And so one of the sad parts is a lot of people don't understand that there is a difference between natural science and the way people talk. In natural science, a theory is not it's not I saw something, so I believe this. And theory is, I saw something, I made a hypothesis, I tested it, and based on the fact that I could not reject the test, based on the fact that the test gave me these results, I have to say that this is what I believe. Now, when we speak, a lot of people say, "Oh, well, I have a theory," and it's not a theory; it's a hypothesis. They never tested it. That's actually one of the big differences between natural science and other things. Our theories have to have tested. The reason we call them theories is because we're not done with them. Every time we take a theory, every time we make a theory, we're going to test it and test it and test it, always constantly testing until we find some error to it, and then we fix it. The idea is we can never know anything. We're constantly trying to improve our knowledge. Way to actually think about it is if you think of Newton's laws. Newton's laws came about, and all physics was based on that. And then all of a sudden, we ended up getting quantum physics and the physics in the submolecular, subatomic levels, and the Newtonian physics didn't quite work in those situations, and so we had to modify the theories of physics. Pretty much the theories that led us to all the technologies that we end up having in the 50s and 60s had to be modified because it wasn't complete when you started looking at the grand, cosmic area or the subatomic area. Things had to be changed. And that's why we have theories. We're always trying to find that next level of absolute truth, and we can never get it. So in science, what we do is we get all these data, and we actually base our idea on data. Now, one of the problems that happens is sometimes people will get data and use it different based on what they want, or they'll look at different things. So for instance, in martial arts, there's a lot of arguments on how katas should be used and how katas should look. I'm of the opinion that everything should be based around Iken Hyatsu. Pretty much one move should end the world. One move should end the fight. And so I'm looking for in katas, I'm pairing it with clinical anatomy, and I'm trying to find the injuries that will end the fight in one move. And I'm trying to find it. I'm actually also testing it on myself. I usually take my kids, and if it works for my kids against me, then I figure, okay, that's a good move to use. If it doesn't, I then have to reconsider how much difference of a mass and weight do I have to get before it does work. And is it appropriate to teach that? The other thing that ends up happening is sometimes people are looking at the same thing, but they're looking at different benefits. So for instance, I'm looking at kata just as the ability to find points for Iken Hyatsu. Someone else, I have a friend who I had this argument with, is looking at kata as a way to determine, a way to get people more physically fit. So he's using it for stretching, for calisthenics, for athleticism. So he's using bigger moves. He's using longer stances. He's using all these different things meant to help the muscles. Now, if he's doing it correct and he's not damaging his body, we can actually both say, okay, well, he's using it for this, and if he's using it for stretching, that's fine. If it's destroying people's knees, that's another thing. I'm using it for Iken Hyatsu. I'm trying to find the ways that these katas work to end the fight immediately. And I believe that based on neuroanatomy, if you're practicing moves, your mind actually gets better at doing the moves the way you actually practice them. So you're going to practice the moves in the kata the way that they would be done in reality. That way it fixes them in your mind. If you change them, you change what you're going to do in reality in an emergency situation. And so, like I said, these are two competing views that, they can work together sometimes. They sometimes are a little different, but, we can argue about that. And neither one of us will be right or wrong because of how we actually are viewing reality. But if you are looking at it as, okay, well, if I'm using it for Iken Hyatsu, yes, I will say mine is correct because that way, if you're practicing Iken Hyatsu, you're always practicing it. You're not trying to make it a point sparring. You're trying to destroy the opponent. So that is one of the things that's different between opinion and science. In opinion, you can use science to make an opinion, but a lot of times it's not always correct. Now, in medicine, people talk about medical opinions, and that's this. You have all the facts, and you have to determine what's wrong with the patient. Now, in that case, there is actually a right or wrong. Right diagnosis or wrong, it's not just the medical opinion. The opinion may be on what's the best way to treat it, but each patient will actually end up changing the treatment depending on who they are. Now, like I said, I actually have a couple lists which will give you the clinical anatomy. If you actually watch the self-study anatomy program, you should be able to get all the anatomy you need. So anytime I talk about a subject, you'll have more of an understanding for anyone else, and you'll be able to pretty much ask intelligent questions or understand the questions understand what I'm doing better than someone else. Clinical anatomy is not just Some people will say, "Well, I took clinical anatomy," and when you start talking to them, all they've done is regional anatomy. Clinical anatomy is how anatomy presents in clinic. So it includes physical exams, it includes fractures, it includes clinical presentations and changes in anatomy. It includes embryology. It includes a lot of different things. And so, with this, the I guess what I'm trying to say is, with all this, what I'm trying to give you is the gift of being able to understand anatomy, to look at basic injuries and interpret them yourself. Now, if you're able to take the clinical anatomy and you're able to move it into your karate or martial arts, you can make a far more lethal and devastating martial art than if you just think, okay, well, we're just going to go outside and beat each other up. Imagine the difference between someone knowing how and where to strike someone and only going for those points versus someone who just comes out and it's like, I'm just going to swing randomly. Well, the person who swings randomly can sometimes get lucky or unlucky and hit a person to a point where, and with one hit and end the fight. You also have some people who will, will actually know where to hit, and will be able to hit someone right in the right spot to end the fight like that. Now, which one would you? There's an old saying about how luck prefers the prepared mind. If you're training to in Iken Hiatsu and you get attacked and you need it, you'll know right away where to hit. You don't have to think, okay, where was this? Where was I supposed to hit? It's just going to be, target. There's a target there. Boom, hit it. There's a target here. Boom, hit it. And if not, you are going to be, okay, I'm just going to hit everywhere and hope something works. And that's actually the gift that clinical anatomy gives you. That's also, by the way, why one of the main things that you need to understand how one punch can end a fight. Only through clinical anatomy can you even begin to comprehend it. People who don't know clinical anatomy can't really talk about this stuff because what they end up getting is, instead of showing, okay, this is how the body is, this is where it breaks, this is where it doesn't, they start saying, well, my teacher told me this, and my teacher was a 10th degree black belt who learned from flying monks on some tropical mystical island. And the truth is, if you actually have clinical anatomy, you can make a lot of these moves that are actually in legends, and you can actually find out that a lot of them apparently have if you look at it, they actually could have potentially happened. Now, I hope you enjoyed this video, and I hope you will consider subscribing and asking me questions. Next week, I'm going to talk about the elbow. I am, because I got a question about, in which someone said how their teacher was telling them to do it based on what's going to win in tournaments, and they're getting tennis elbow, which I'll actually explain why some people are getting it. I hope you enjoy this. Have a nice day.